We're ready to begin, Chairman.
Okay, Tanisha, would you please call the roll?
Yes. Norman Boyd,
Here.
Russell Crutchfield,
Present.
Cynthia Rucker, Cynthia Rucker, I think I hear you trying to say something. Just make sure you're unmuted because I do see you on the line. Cynthia Rucker. I'll come back. Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
Shane Mobley, Robert Coles.
Here.
Thank you. And I'll go back over the roll. Cynthia Rucker. Maybe having technical problems, but I do see that you are on the meeting. And then last call, Shane Mobley. Chairman, that concludes my roll call.
Thank you, Tanisha, and thank all of you for taking the time to be with us today and participate in our meeting. Welcome to all of you. We do have a quorum to conduct business, and we have a rather brief agenda today. There is one item that we'll be asked to consider for initial adoption after presentation. So we will move right on into the program, call the meeting to order. And the first thing on the agenda is the asking Dr. Rucker to, if she's read the minutes from the last meeting and if she recommends approval. If she's not on the line still with technical difficulties, we'll move on and come back to that. So Dr. Rucker, are you on the line now? Apparently not. So let's move on in the agenda, and we will go to the committee report for the Care Management Committee met this morning, and the chairman of that committee is Anthony Williamson, and we'll ask Anthony to make his report on their committee meeting, if you would, please.
Thank you, Chairman Boyd. We did meet this morning with great attendance, and Lynette gave us some really good updates on three topics this morning that were the focus. The first was the end of the continuous enrollment that has for Medicaid that has been in place essentially since March of 2020 when the PHE began, public health emergency, and we were informed that that continuous enrollment phase is coming to an end on March 31st, and the department will be working over the next 12 to 14 months to do a complete redetermination and renewal of all our enrolled members. We also focused a little on the ending of the federal public health emergency, which Lynette shared has been announced for May 11th of 23. That will impact some of the waivers and flexibilities that we've been able to operate under as part of the PHE. That includes things such as flexibility with how we handle co-payments, as well as prior authorizations and provider enrollment. So all of those things will have an automatic stop when the PHE ends. However, Lynette shared that should we determine that we may want to continue with some of those, there's a process for us to do that with CMS approval. So more to come on that. And then the last area that we focused on was just an update on our procurements that the department is working on. The CMO procurement is underway. The request for qualifications went out on January 3rd. The RFP will be following as more information becomes available. We will be also procuring a new pharmacy benefit manager a new Medicaid management information system. And then another big part of that update was the pathways to coverage waiver, which is something we're all familiar with. That will go into effect on July 1 of 23, and it will allow for some expansion of the eligibility criteria that folks have the ability to become eligible for Medicaid with that expansion underneath that waiver. If they meet certain criteria, things such as employment or being a college enrolled student, some of those things that we've heard of before. And that was the end of our meeting. It was a lot of information was packed into it. And I thank Lynette for doing a great job of pulling all of that together for us.
Thank you, Anthony. Are there questions for the Care Management Committee from any of the board members? Comments? Hearing none, sounds like you had a full agenda this morning, and thank you for that report. With that, we'll come back to the minutes of the last meeting if Dr. Rucker has been able to join the meeting.
I am on if you all can hear me.
We can hear you fine. Thank you. Have you had a chance to look at the minutes from the last meeting?
Yes, sir, Chairman. I have reviewed the minutes from January 13th, and I found them to be in order, and I recommend they be approved as stands.
Minutes of the prior meeting, January 13 meeting, has been recommended for approval. Is there a motion for approval?
Dr. Lee, make a motion for approval.
Been a motion for approval. Is there a second?
Second. Dr. Coles.
Dr. Coles has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved, and thank you very much. With that, we'll move on to the commissioner report and ask Commissioner Nagle to give us her remarks, please.
Thank you. Good morning, Mr. Chairman, members of the board. Committee Chairman Williamson did a great job providing some updates from that committee meeting, so I won't repeat some of them, which would be the same, just maybe add a couple other bullets. And really a word of thanks to all of our partners that are helping us move forward with the pathways to coverage implementation. We're still on a July 1 target date. That's an aggressive timeline. We re-engaged with our federal partners and have established almost weekly meetings with them to make sure that we're staying on track and meeting their timeline as well as our timeline. And that's a statewide effort of both us, our sister agencies and partners, as well as a number of business and trading partners. So thank you, everyone, for sticking with us and working really diligently with us as we try to get that new coverage option up and available to Georgians. We're particularly looking at that as a additional, again, like it's called pathway to coverage, as we perform all the redeterminations that were talked about as a part of the end of the continuous enrollment requirement, so that individuals have another option to stay covered in Georgia, and hitting that July 1 target is really important for us, so that folks have that option. The biggest thing right now that we're working on is really making our way through the legislative session. We've started out a little bit slow, but things are pretty much in full swing at this point. We are monitoring and watching the department's budget and a number of bills and items as they move through. We have presented our budget, amended FY23 budget, both the joint budget hearing, the House and the Senate. And so we'll see ultimately what comes out of that, but very pleased with some of the governor's recommendations. A lot of our budget this year was really just not specific programmatic increases or changes, but a lot due to FMAP changes, or our federal cost sharing, specifically related to the end of the public health emergency and the end of the continuous enrollment. That also coincides with shifts in how much money the feds cost share with us on our Medicaid match. So as that amount comes down, it's been increased over the last couple of years. The state funds that need to come in and replace it are increasing. And so there's a number of shifts that will happen in both the amended 23 and the FY24 budget. We're also really pleased to see nearly $1 billion or more recommended by the governor for an infusion and additional revenues for the state health benefit plan. We've talked about that a little bit, and we'll share some additional information. The Department of Audits did a performance review last year that I think you've all received at this point. It was very thorough, and we really appreciate their work in that effort. And it's really helped clarify and state the case for why SHBP needs some extra attention this year. So we're supportive of those changes, and specifically in SHBP, and we're hopeful that those will carry throughout the budget. I'll just close with highlighting some employee milestones that I always like to do. Willie Dean in our Healthcare Facility Regulation Division, Kenneth Booker and Dr. Kelvin Holloway are celebrating 5 years of state service. Dr. Dean Burke, who joined us in January, and Rhonda Jones are celebrating 10 years with the state. Milani Payne is celebrating 15 years, and Michael Henderson in the Medicaid division is celebrating 25 years of service. And again, we couldn't do anything we do at the department around the state without our dedicated staff. So thank you all very much. Happy to answer any questions, Mr. Chairman, but that concludes my remarks.
Thank you, Commissioner. Are there questions, comments from the board, please? Hearing none. Thank you for that update. And the one item that we need to consider for a vote today is Medical Assistance Plans Comprehensive Support Waiver Program for initial adoption. And Brian Dowd will make that presentation. Brian, please.
Thank you, Mr. Chairman, Commissioner, and members of the board. I am presenting today for initial adoption a comprehensive supports waiver amendment to increase all services in the comprehensive supports waiver by 5% plus 2% for a total of 7% increase. Effective July 1st, 2023, with DCH board approval and Centers for Medicare and Medicaid Services approval, DCH is proposing to make permanent an initial 5% increase and an additional 2% increase enacted in response to the public health emergency. DCH, in collaboration with their sister agency, the Department of Behavioral Health and Developmental Disabilities, enacted 2 temporary rate increases during the public health emergency utilizing Appendix K authority. This waiver amendment seeks to make those temporary rate increases permanent. The state match funding for the increases were legislatively allocated to the Department of Behavioral Health and Developmental Disabilities to cover the cost of the increase in the waiver. The proposed reimbursement rate change is estimated to increase expenditures in state fiscal year 2024 by a total funds amount of $53,400,926, of which $18,145,635 are state funds. For transparency in the public notice, we have listed all the rates with the increase. It's important if calculating those rate increases to mirror what we did for the public health emergency and calculate the initial 5% rate increase and then add the additional 2% rate increase to that 5%. If you don't do it that way, you'll get pennies off on the rates to get to that 7%. Also in the public notice, we have included outlier years expenditures for state fiscal year 2025 and 2026. An opportunity for public comment on the proposed changes will be held February 15th, 2023 at 11 a.m. via Zoom. Individuals wishing to comment in writing on the proposed changes can do so on or before March 13th, 2023. If you have any questions, I would be happy to answer them in this time and respectfully request your initial adoption of the waiver amendment to permanently increase rates in the comprehensive supports waiver.
Any questions, comments from the board, please? Brian, as I understand it, this is simply making permanent something that's already been in place during the health emergency. Did I interpret that correctly?
You have that 100% right. We are making permanent the rate increases that we did temporarily under this Appendix K authority during the public health emergency. You are correct, sir.
Thank you. This consideration is for initial adoption, and as Brian gave us the outline of the public notice, et cetera. Is there a motion from the board for approval for initial adoption?
Roger Folsom, motion for initial adoption, Mr. Chairman.
Yeah, Roger Folson has made the motion for approval. Is there a second?
Russell Crutchfield, second.
Russell Crutchfield has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved, Brian. Thank you very much, and we'll see what the public comments were when we represent. Thank you.
Thank you, sir.
With that, does anyone on the board know of any new business that needs to come before the board at this time? Hearing none, our brief meeting will be brought to a close, and our next meeting will be at this same time on March the 9th. And again, I thank all of you for taking the time and participating, and we appreciate the background work that's done by the department every time to provide us this information in advance so we have a chance to read through it and see the presentations before in writing. So we appreciate that, Brian. Appreciate your background work. Thank you very much. And with that, the meeting shall be adjourned. Thank you.
Thank you.
Thank you.